Now, Chris 6 News at 6 continues.
A recent report by the Centers for Disease Control says cases of 3 sexually transmitted diseases are at an all-time high in the United States. As Ashley Portillo explains, that trend is being repeated right here in Nueces County.
Back in May, we told you the total number of syphilis cases in Nueces County in 2009 was 30, but for the first half of the year, the total number of cases was 146. Now, the health department expects that number to climb to 300 by the end of the year, and that number is what has many local doctors and clinics concerned. In the past year, staff at the Women's and Men's Health Services of the Coastal Bend have been making about double the number of phone calls to patients who test positive for STDs.
A lot of times they're shocked, but I try to put them at ease, try to give them the information that they need.
In the past year, 2 new clinicians had to be hired to keep up with about a 40% increase in the number of patients. And syphilis is the STD that has county health officials concerned. In 2017, there were 221 total cases of syphilis. 2018 totals are expected to climb past that.
What we saw in 2017 was saying this isn't a fluke, this is really happening, and it's something that we need to take seriously.
At the start of the year, the health department implemented a strategic plan to get ahead of the disease. They are partnering with the Coastal Bend Wellness Foundation to provide treatment and outreach events. The department also implemented express testing, which allows them to test more patients. And more state funding has been given for outreach and preventative treatment.
I think syphilis has to be treated. Left untreated in the very long term, it can lead to mental problems, all kinds of physical problems. So we need to go in and get routine screening.
Ashley Portillo, Chris 6 News.
And the health department says STDs could be on the rise for several reasons. Among them, a bigger use of dating apps and more people who simply don't test because they don't think they're at risk.